Okay, so this is a short lecture about LVH criteria on EKG. You might be asked that a lot while you're reading your EKGs. Basically, there are tons of criteria for LVH, but for your level, you can use those two simple methods. Either you look at lead AVL and measure the R wave. If the R wave is above 11 millimeters, then this goes with LVH. The other criteria, which might be a little bit more complicated, but it's very good, you look at the R wave in V5 and V6, you measure its height, and then you add it to the S wave on V1. If the sum of this makes it more than 35 millimeter, then the patient has LVH. Let's see how it looks in examples. If you look at this EKG, you can notice that the R wave in V6 is too tall. Okay, if we count it, it's going to be 5, 10, 15, 20, maybe 25. So the R is going to be 25. While you add it to the S in V1, and the S in V1 is going to be from here till here. It's going to be 5, 10, 15, 20 or so. So the S wave is 20. If you add them together, you'll end up with 45 millimeter, and that's above than 35 millimeter. So that tells me that this patient has LVH. While if you look at this EKG, doing this R and S criteria might not be enough. See, the R in V5 and V6 it's not that high. S might be high, but if you add them together, you might not reach 35. But if you look at AVL and count how many boxes you have for the R wave, you're going to see that you have at least 5, 10, 15, and maybe a little bit more. Let's call it 15 millimeter. For that criteria, we said AVL, the R should be higher than 11 millimeter. If we have 15 millimeters, so this patient has LVH by the AVL criteria. And this is how you can basically say if your patient has LVH by just looking at his EKG.